I see a cross-section of patients. Mainly I see a very large selection, because I've been here for such a long time. I see a lot of personal friends or acquaintances. We do a lot of very, very good quality general dentistry. We do excellent crown and bridge work, we do a lot of implants, we do endodontic treatment, dentures. Whatever the patient needs, we try and service them. And if we can't, then we've got a very, very good network, an experienced network of specialists. Be it an oral surgeons, be it endodontists for the complex work, excellent orthodontists. And we get a good rapport from the patients, enjoying what they've seen, and we get a good relationship with them. Often they only come because they're fearful, and they just want to get the minimal amount of work done. Very often it's a financial situation where many years ago they couldn't afford to get more work done. 10 years later they can. Often you'll get people who know they've got a lot of work to be done. They can still smile, but they can't eat correctly or whatever, because a smile is more important. They'll get that fixed. Then they'll come back when they can. They'll come back 5 or 10 years later and say, yep, I'm having it all done now. And that's rewarding. Not everyone is in the same needs bracket, not everyone is in the same economic bracket. So you have to try and satisfy people. We don't try and belittle people. We tell people when they come in an emergency, we'll get you out of trouble, you have other things to do, and when it's necessary you come back and see us, and they do. Could be in 6 months, could be in 2 weeks, could be in 5 years, but they still come back. I think the greatest buzz is when someone comes in, and you can see quite a few of them, you've actually changed their life. All of it, you don't realise if you've got natural good teeth or whatever you have, the effect that it can have very rotten mouth or bad breath, or they're psychologically really inhibited by it. They won't smile in photos. I remember a young girl telling me, now I can smile in a photo. I had a patient this week, when we whitened her teeth, she looked at it and started to cry. She was so happy. We had one man, we made him dentures, and before we made them, his teeth were horrifically broken down. He had a big beard and bushy, scraggy look. He came in for a checkup and he'd shaved his beard and had a haircut. We didn't recognise him. And it was just a complete style change. He went out and got a job. And that makes a hell of a difference to someone, something as simple and as fruitful as that.